Hi, my name's Easton.
And my name's Marley.
Whenever I first saw it, I was thinking it was going to be a tool chest, but whenever I saw this, I have no idea what this is. I'm going to guess whenever they hammered like nails down,
I wonder what that is.
and they would probably pull them out if they weren't nailed in right or correctly.
They kind of look the same, don't they?
Yeah, they do.
This looks like tweezers. You could clip your hair with it.
I don't know what this is. I'm going to guess that you would use this for taking out some branches that are very loose and they're very big. Just clip it on there and then yank them out. We're going to say that's a cup.
It looks like a little, like a candle holder that you keep your candles in.
Thicker than glass, not as clear as glass.
Yeah, it's like.
Then again, the glass at church, some glasses are tinted in.
I wonder what this is. This is like, it opens.
Looks like a medical tool.
What do you think?
So we were thinking about these
This
right
looks
here.
like tweezers.
Tweezers.
Yeah, they're kind of specialized, aren't they?
Yeah.
What do you think that is?
Toolbox. It looks like a toolbox.
Well, it is a toolbox of sorts. What do you think?
You know, like if a hairdresser kind of came to your house.
Mm-hmm. Somebody made house calls with that, didn't they? Well, you're right about that. But this
Or
is
a
not
doctor.
There you go. We're getting close now. This is a doctor's bag, and you
Or
can
maybe
tell
even
how old and
bag.
fragile it is, and so that gives all of these a different.
Mm-hmm.
And it's an eye cup. It fits
Oh.
exactly over your eye, so you could do that. This is called a forcep.
Yeah.
And, you know, this is what widens it. It releases it.
What does it do?
Well, it pulls something.
Like maybe if like your knee got popped out of place.
Maybe, or maybe if you're having a baby and the baby was slow coming. This is a forcep that's used for birthing babies. And when this doctor came to your house,
He was a dentist too?
He did whatever you needed done. So what do you think about that?
Well, no. It kind of looked like with the sharp tooth, it would do fingernail clippers.
Yeah, it does. And it might be like if you had a splinter.
To pull it out.
It's hard to know.
Which is horrible to have splinters because I got one yesterday.
It hurts
And
really
then
This
bad.
kind of looks like something that you would sew with, like what you put your needle or something in.
Well, you know, I think you're probably right because you have to hold two things together, and sometimes that's your skin, isn't it?
That just pains me just to
It just hurts to look
Feel.
at it.
feel that pinch into your skin. It probably doesn't feel that well.
But just to think that
Yeah.
house calls used to be made, and they would bring their bag, and a lot of times they would be on horseback.
Which is probably fun to ride.
Well, you know, I've heard that the old doctors used to just kind of nod off. They'd be so tired from making house calls, they'd go to sleep sitting on their horse. But they would have all this with them because they probably didn't know what they were going to be facing when they got there. It could be a childbirth, it could be cuts.
You don't know because they didn't
They didn't have a phone, did they? Somebody would have to ride up and say, "Hey, Doc, we need you over at the old such and such place," and he'd just grab everything that in there, and he'd be ready.
Are those like the medicines?
Those are some of the old medicines.
Cute.
A key, I guess that's the key to his case, isn't it? We can say that this is probably 100 years old.
I was close.
Yeah,
A little older than my grandma.
A little older than your
Just
grandma.
a little.
A little bit.
Is going to turn
A little bit older.
in a few years.
A little bit older than my great grandmother. She just turned 93.
Yeah, well, you ask her to look at your video and tell us what she can remember about that.
Yeah.
Okay, thank you guys.
You're welcome.
Thank you for watching Behind the Scenes with the Museum
Museum
Kids.